Welcome to the first day of a very new paradigm in medicine. It's called Breast Cancer Prevention Month. Not awareness, but prevention. It's time to take action. We are fully aware of the problem. With me today is Dr. Cedric Garland of UCSD Moores Cancer Center. Thank you for being here.
It's a pleasure, Carol. Thank you.
Dr. Garland is one of the world's leading researchers on vitamin D and cancer. And I'm Carole Baggerly, Director of GrassrootsHealth, which is an organization dedicated entirely to getting the word out about vitamin D. And we have now launched Breast Cancer Prevention Month to fully demonstrate that vitamin D can have preventive capabilities with breast cancer. To this end, we are offering for 1,000 brand new enrollees in our study, 1,000 women who are 60 and over and who do not currently have cancer, the opportunity to participate in a 5-year study, taking a vitamin D test each 6 months and filling in a health questionnaire. Dr. Garland, I've got several questions for you that I think our audience would like to know.
Certainly.
Since we're specifically looking for women 60 and older who might be in the prime of maybe even getting breast cancer, how fast does vitamin D work to help prevent it?
It works within 2 years.
2 years. Even if I'm over 60 and fully ready to more happen.
It works at all ages.
That is fantastic. You also have a model for breast cancer or for cancers in general about why vitamin D works. Could you please tell us a little bit about that?
Sure. It's called the dynamite model, and it has several phases. But the first phase is dissociation of the cells in the epithelium of the breast. Those are the cells that give rise to breast cancer. The dissociation occurs when the mesh that holds the cells together weakens, and it's weakened by a deficiency in vitamin D or deficiency in calcium. And it can be maintained with adequate vitamin D in the blood and adequate intake of calcium. When the mesh breaks down, the cells begin to compete rather than to cooperate. There's natural selection of the most aggressive cells, and cells that reproduce fastest, and those cells that compete with other cells end up being overrepresented in the tissue. Those are the clone that we call cancer. But we can stop that from the get-go by preventing the mesh from falling apart. But even later in the natural history of the cancer, we're able now to see that we can stop the growth of the cancer by preventing vascularization of the cancer. And vascularization is what a tumor needs to become very aggressive and take over.
What role does genetics play in breast cancer?
Very little, not more than 10% of breast cancer can be accounted for by having a so-called genetic predisposition. 9 out of 10 cases occur without any familial predisposition or no genetic factor in them. So if we focused on genetics, it might be interesting, but we wouldn't be preventing much breast cancer.
And we are obviously within a public health realm targeting, in one sense, the biggest bang for the buck. I mean,
we're targeting the
go for
90% that are not genetic, and
right.
also hoping that even the 10% that have a genetic predisposition will be prevented from getting the disease by the same strategy that works for the 90%.
That's fantastic. What about now that we have initiated this breast cancer prevention paradigm, what do you think the significance of that is?
Well, I think for the first time since breast cancer was described by Hippocrates 2,411 years ago, we're going to be in a position to prevent it rather than just hoping to detect it early or mitigate its complications. We really have entered a new golden era in medicine where we're able to prevent breast cancer.
And with the prevention of breast cancer, believe it or not, you'll also prevent colon cancer and a host of other diseases. Again, we have a study being offered for 1,000 women that we would encourage you to enroll in. Please look at grassrootshealth.net, which you'll see on the bottom of your screen, and take a look at what the study is made up of. Again, it's a vitamin D test and participation in a study for a 5-year period. And we want you to participate, and we want you and your friends to donate to keep this project going. Thank you so much for listening, and get your vitamin D up and be healthy. Thanks again.